Disturbed sleep pattern is a NANDA nursing diagnosis that involves a disturbance in a person's regular circadian or sleep pattern. This may encompass several environmental, biological, example, insomnia, sleep disorders, or physiologic factors, example, distress. Quick facts that nursing students need to know about disturbed sleep pattern. Sleep history. Understanding the patient's sleep history can provide insight into their current sleep pattern. Ask the patient about their usual bedtime, how long it takes them to fall asleep, how often they wake up during the night, and how long they sleep. Sleep environment. The sleep environment can affect the quality of sleep. Ask the patient about their sleep environment, such as the noise level, temperature, lighting, and comfort of the bed. Medications. Some medications can affect sleep. As a nursing student, it's important to know what medications the patient is taking, when they take them, and whether they have any sedative effects. Anxiety and depression. Anxiety and depression can affect sleep. As a nursing student, it's important to assess the patient's mental health and provide appropriate interventions to manage anxiety and depression. Substance use. Substance use can affect sleep. As a nursing student, it's important to assess the patient's substance use history, including caffeine, nicotine, and alcohol, and provide appropriate interventions to manage the effects of these substances on sleep. Nutrition. Poor nutrition can affect sleep. As a nursing student, it's important to assess the patient's nutritional status and provide appropriate interventions to maintain adequate nutrition. Physical activity. Regular physical activity can improve sleep. As a nursing student, it's important to assess the patient's physical activity level and provide appropriate interventions to promote physical activity. Sleep hygiene. Poor sleep hygiene can affect sleep. As a nursing student, it's important to assess the patient's sleep hygiene, including their bedtime routine and sleep habits, and provide appropriate interventions to promote good sleep hygiene. Support. Sleep disturbances can be distressing for the patient. As a nursing student, it's important to provide emotional support to the patient and their family to help them cope with their condition. Insomnia. Nursing diagnosis. Disturbed sleep pattern related to dysfunction of the environment or physiologic factor, secondary to insomnia, as evidenced by the decreased quality of sleep, disturbed sleep, sleepiness during the day, difficulty falling asleep. Desired outcome. The patient will demonstrate improved rest and sleep patterns. Intervention. Assess the patient's sleep pattern and take note of the following: the amount of sleep, position, sleep routine, position, depth, extent, and interferences. Rationale. Sleep patterns may vary for each individual. Evaluating these patterns will provide general information and details on certain areas of sleep that need to be addressed or improved. Intervention. Observe for any signs of sleep-wake problems. Note the patient's hours of sleep. Rationale. To attain baseline information for the investigation of insomnia. Intervention. Take note of the physical, example, background noise, discomfort, frequent urination during bedtime, pain, or physiologic factors, example, fear, anxiety, that hinder sleep. Rationale. To aid with insomnia evaluation and help with its management. Intervention. Educate the patient on several measures for sleep promotion, such as avoiding heavy meals, smoking before bedtime, caffeine-containing beverages, and alcohol. Also, mention proper fluid and food intake. Rationale. It is important to mention the needed precautions and reminders to better promote sleep. Beverages such as tea, chocolate, colas, and coffee contain caffeine that activates and energizes the nervous system. Whereas taking full meals before bedtime may induce indigestion or an upset stomach, hindering sleep onset. Alcohol should also be avoided, albeit its ability to induce sleep, since it hampers REM sleep. Intervention. Encourage the patient to adhere to a dedicated and consistent sleep and rest schedule. Suggest drinking a glass of milk. Rationale. Adhering to a consistent sleep and rest schedule helps regulate and manage the circadian rhythm. It is also likely to reduce energy fluctuations or consumption required for adaptation to alterations. Meanwhile, drinking a glass of milk has been correlated with sleep promotion, mainly because of its L-tryptophan component. Visit usanursestudy.net for over 1,000 free nursing diagnosis and care plans.